getting stuck on, that whether you should be registering eye banks if they don't have a specular microscope, even though it's required by law. So sometimes the person who is going from the state to do the registration, they have to take a practical situation depending upon their need. That is why health is a state subject. So my advice would be that as far as possible, every eye bank registered as an eye bank should have a specular microscope or have access to a specular microscope, and that is what we should encourage and insist, so that we go to the higher level.
No, I think I'm in full agreement with that because that is the only way forward. With specific regards to the question about the 80 plus, I would, other than in therapeutic purposes, where we're trying to just save the globe, I would rather not use them. But so from optical purposes, unless I'm absolutely sure with a specular microscopic backup.
But Percent has shown very good results, optimal results, even with 80 plus eyes.
I have great results with eyes that have been in the moist chamber for more than 24 hours. But I'm not sure if that should be the norm that we would recommend as a take-home message. So that there are good results, but they're more anecdotal. And how long will it last is the question. So will that cornea last as long as, say, a 45-year-old with a good cell count? So I'm not sure. Especially if this eye is from a pseudophakic background, if he's 80, it's quite possible that he's had surgery, and I'm not so sure.
And the other factor which comes into play is when you have an in-house surgeon and an in-house eye bank. So in that situation, the surgeon is going to use it himself. He has a confidence that if it doesn't work, I'll just exchange it. So that makes a lot of difference if the surgeon himself is an eye banker and has the eye bank in-house. Whereas if you're talking about places where the eye bank is going to release to external surgeons, then also so those are the eye banks who are now saying that 80 plus we will not recover, we will not release, because they are also on the back foot if then the surgeon complains later that we don't want to use it and they return it. So then they've taken the tissue, they've sent it to the surgeon is refusing to use it, nobody wants to use it. So therefore I feel 80 plus can be used if the tissue is very good, and it's very encouraging to say, and I personally, I always do say that we should not put age as a factor. If the cornea looks very good and you can put it in a suitable patient. Sometimes we have 80 plus patients who are going for the surgery also. Sometimes 80 plus patients, we tell them not to go for the surgery because we say it's not useful. So that's the situation. And one more thing I'd like to add is that just saying one more thing related to age is largely one would like to see the quality of the tissue and like to match the age according to the recipient. So the other point of discussion was THOTA. So as we would like people to give feedback if their state is registering eye banks under THOTA or not. So Ganesh, can you give us the update as to which are the states in India? So everybody should know that the Transplantation of Human Organs and Tissues Act, the rules have now been released in 2014. So after that, even if you previously were registered, you have to get yourself re-registered under the new rules. So this exercise has been done by several states, but Ganesh will give us a list of states which has not yet done it.
State, both Andhra Pradesh and Telangana have not started registering. In Kerala, some parts of Kerala it has not begun, but otherwise all the states have started registering eye banks under THOTA. J&K also, it is now under process, so most likely Jammu and Kashmir also will start registration under the Transplantation of Human Organs. There is a general doubt about getting registered in NATO. People are generally writing to us asking whether, apart from the state registration, do we need to get into NATO also, and whether NATO registration is enough. I mean, is a kind of this thing for Transplantation of Human Organs Act. The NATO registration is welcome basically because of the registry, on the registry angle, but that state registration is a must. And NATO registration will help because the registry that being formed it will add value to the iBanking on the whole, both recipient data and the donor data.
Yes. Yes, yes, of course, yes. Yes.
Our hospital is registered with the DGHS for transplanting corneas, and we have also iBank Association lifetime membership, institution membership. But when we tried to register for this NOTO, it was very difficult. So we couldn't get across people to do that. I don't know what is the problem. Approaching them was also difficult. And Director General of Health Services, I don't know which place we have to approach. If you could give me the contact number or address, it will be. And in the state, to whom we should register? Because we asked the program manager who is in charge of the Pondicherry state, they are not aware of this.
So when you're talking about the state, firstly the state has to, health being a state subject, each state has to officially adopt the new act. Most states have, or union territories, they have to adopt the new rules, which is of 2014. There are certain key differences in the new rules, which is why it's important for them to officially accept. One key difference is that it is allowing trained technicians to harvest the tissue, whereas previously it required a medically qualified doctor or from allopathic doctor, so not even Ayurveda or other ones. It had specifically required that the tissue has to be harvested by a medically qualified doctor in the previous act. 2014, the rules have stated that a trained iBank technician can recover the tissue. So there are certain key differences. I will give you an example of 2-3 more. So the other important one is that the 2014 rules, though the act, amended act did not accept in 2011, though we represented to accept research use, but luckily the rules have given the provision that for the eyes, once collected, if found to be not medically suitable, they can be used for education and training. So therefore, it's very important that every state officially accepts the act. And to the best of my knowledge, most states have accepted it verbatim, but some states have made some changes. Like for example, in Punjab, they have put their fee as 10,000. According to the rules, it is supposed to be 5,000. So 5,000 is the application fee for a corneal transplant center, 5,000 for an iBank. So if a hospital has both, they will put 2 separate applications. The same institution will put 2 applications, 5,000 each. Whereas in Punjab, earlier in Punjab, it was 3 lakhs. Because they were of the thinking that they're only private. So they had 2 or 3 lakhs was the application fee. But luckily they have changed it, and they have changed it to 10,000. So this is so therefore, firstly the state has to notify that they have accepted it, and then the all the iBanks and the transplant centers have to be legally registered. And the 2014 rules also specifies that NOTO is a national body, and everybody has to be registered with NOTO also. So legally, it's mandatory to be registered with your state. So you require a transplantation of human organs and tissues certification. So if Pondicherry is a union territory, it should be with your Directorate General Health Services. NOTO is very easy. You just go to the website. You just go to the NOTO website and you register yourself. It is just as Ganesh said, it is more a practical that you're in the system and that your data is getting shared and that you're present. But you can continue functioning even without it. But your state or union territory registration is mandatory. So iBank Association of India membership is required to give you the professional inputs. And so for Pondicherry, it must be the union territory or DGHS. So you must have a copy of your Pondicherry is a state. But like Delhi is a state as well, but it functions like a union territory also from the health point. Yes, it's like Delhi. So yes, so you must be having your old certificate. You have to reply to the same authority for the new certificate. Yes. And I know that in NOTO website is quite easy.
Okay.
It looks difficult initially, but you just go to the website. You should be able to register, and there's a phone number there.
I will try it. Thank you.
From what I understood was that you have an iBank registration and a transplantation center registration.
No, sir. Sorry, iBank we have with iBank Association of India, but we have a corneal grafting center only.
So
we didn't go for iBank because the requirements are.
So you're not looking for iBank registration?
No.
Only for transplant center?
Transplant,
okay.
Yes.
That's probably easier in many ways.
And I also want one doubt regarding this conferences, iBank Association conferences. Last time we missed it because I don't know, our communication was not there. So we would like to get the thing regarding the forthcoming conferences so we can attend.
So it's on 15th and 16th of September in Pune.
Okay.
So that's just for everyone's this thing. You will of course receive the mails through the office.
Okay. Anyway, I will go to the website and see because I would like to come there and.
Yes, so the date is fixed, 15th and 16th of September in Pune, and we can just check if your information is updated, because what happens is when you have institutional membership, maybe in the EBAI database, there may be the phone number and email ID of the person who's first had given, and that person may have changed. So usually that is what happens with institutional members. So just now you can just give him the information, and you can always give two. Yeah. Because sometimes that institutional thing, somebody may be checking, sometimes the email address also changes, and you can give the contact details, and we would definitely encourage people to come, because as Dr. Fogla and Dr. Basak were saying, even the eye banking fraternity, if you see that the ophthalmologists and the corneal surgeons, we are getting updated when we go to the conferences, and we have so many modalities to update ourselves. Exactly. But we are relying on the grassroots. So many technicians, so many counselors, and we do not know how to convey the information to them. So we are therefore encouraging them to attend the conferences. Of course, it is expensive, because firstly the iBank may not be able to spare the person to go to Pune for 5-6 days, who will attend the eye calls. So that is why we are trying to have it in different zones, so at least the local people can come. But definitely if you can send somebody, it is better, because otherwise the next time it comes to your zone will be after 5 years. So it's good to send them turn by turn, and maybe we'll try to have some online updates also, so that at least these technicians and the counselors and the even sometimes the driver who goes on the call, he's relating to the community. So while these people are attending the call, other people may come and ask him things. So these are the things that we need to make sure that information goes out.
I think there was another point that we would have liked to discuss, which was with regards to the directive that the international patients who are coming, who are not Indians, whether they are allowed to get a corneal transplant. Now, I think there are certain states and territories that have adopted that, and the others have still not adopted that. So Delhi, for example, follows that we are not in a position to do foreigners. I have my own personal opinions about that, because it's not a nationwide thing. So there's a pick and choose. So the foreigners still coming in for getting transplants done, but only they can't get them done in certain pockets, but they can get them done anywhere else. So either the policy should be across the nation, uniformly applied, or it should be done away altogether, because I believe the numbers of foreigners being operated is minuscule anyway. I mean, they're probably literally in single digits. So it doesn't dent the total numbers that are being done across the country. And with hopefully, I think with better availability of tissue, we will be in a position to convince the authorities that that is something that they should reconsider.
I think what we could do is we could send a circular to all the corneal transplant centers and members, that if you feel that there are some international patients, give us a rough rate, like it will be per year, 1 patient, 3 patients. And so if we combine this and it turns out, as you said, a very minuscule number, then we can write to the DGHS that this rule can be changed, because also on the other hand, sometimes it comes that you have a person who may be wanting a therapeutic keratoplasty, a non-optical grade tissue, and it's not, the rule doesn't exactly say that foreigners are excluded. It says that the distribution will be local, national, person of Indian origin, and then international. So you may have, say, a DALC, a non-optical grade tissue, where there is plenty of tissue. In fact, tissue is being wasted.
Right.
So those people, there should be absolutely no problem, and even therapeutic tissues.
But in Delhi, they sent a notification to each
So I think
transplant
that
center.
needs to be rewritten. I think that the notification
Essentially saying
needs to
that
be
we were
run.
debarred from doing
Yeah, so
foreigners,
that
and
is
we had to
wrong.
specifically take permission from two authorities, either the Guru Nanak Eye Center or the
Yes. I think this point we
RP
need
center.
to, in Delhi also we can re-look at that. They should reword it.
Yes.
And because if you see the law actually,
It's the
it
lowest
is
on
this.
priority.
It does not say no. It just
Doesn't say
says
no.
that the distribution should be fair and equitable, and this should be the prioritization. And so that is one thing which should be, and that's another thing that the Maharashtra point can be taken, because the law is saying that national. So if there is no person in Maharashtra, then they can give it to the neighboring states. So this point can be taken up.
No, I am telling that in Calcutta, in my hospital, every month we are doing 3 to 4 cases from Bangladesh. So this is quite a huge number. And per year, sometimes it may be 20 also, 25, like that.
So that is another thing. So what to do? But on the other hand, those tissues may have been wasted also.
Because
and
in
if you
some
don't
countries,
use them, then what would you do with those tissues? Because this is a gray area.
even in when I was in LVPI, at that time also many people from Oman, they used to come, from Saudi, they used to come to get this transplantation.
Yes.
In some countries where this is not practiced, they usually come here.
I think it's always better to have it out in the open, and it's better to have it on board that this is it. So we can get an estimate, and then rather than assuming and imagining, we can have a rough idea that these are the number of cases, so that people who are doing it, they should know it's not to be done, and if it can be done, then everybody should know it can be done. So it's better to have it out in the open, rather than, as he is saying, in certain pockets is this way. So it should be clear to everybody that is it allowed or it's not allowed.
I think there is
And
some.
there should be some provision to take. There's always a provision, like even in religion, every time there's something, but there's always a counter antidote. So similarly here also, there should be some provision that you can take permission from the
Authorization committee.
Authorization committee.
Yeah.
So these two sentences we should ask them to recognize. iBank,
Yeah,
a
they
transplant
have
center, yes. iBank also.
Yeah, they have
Okay,
started.
that's good.
Yeah.
Okay, that's very good.
Actually, they also have to have some guidelines to whom to permit. So again, even the people who are taking decision that it may be permitted, but there should be some guideline or justification of emergency by which the authority, the people who are sitting on that chair, so they can decide, because otherwise they also might be put in the rope.
Yeah, like we have for the iBank has to maintain a waiting list. This also should be part of the waiting list only. It cannot be an out of turn surgery for the foreign nationals.
The other thing is the processing fees. So processing fees also is important, because there is a cost involved in making the tissue suitable for transplantation. So and the rules also do state that any cost incurred in processing or making the tissue suitable or the organ available for transplantation can be charged. So some people have the wrong idea that people are charging for the cornea. So that they have to understand that it is nobody's charging for the cornea, but it is the real cost involved in the equipment or the procedure involved in making it suitable for transplantation. And if this is recognized, then more people will be encouraged to use the intermediate storage medium, because in the process of transferring from one place to the other, you need an extra 2-3 days time. Traditionally with MK medium, you would like to operate within 48 hours. So then it becomes difficult to send it here and there. But if you're using the intermediate storage medium, then it increases your transplantation time to 7 to 10 days very comfortably. So that is another thing. So where will that money come from? So we have the tissue sometimes, and some eye banks I do know even have optical grade tissue which are sometimes not being used. So this is the message should go out very clearly that every transplantable tissue should be used, and in order to make it to use, there has to be some support from somewhere to provide the money. So we're trying to push the government also that they can have 5,000 to the eye bank per cornea transplanted, as opposed to the previous system of 2,000 per pair collected. So if there are any eye banks here, what do you feel? You have any difficulty in your funding, or you are able to manage? And what is the processing fee?
Yeah, in our, I'm from Vasan Eye Bank actually. We are providing corneas to across the country, corneal surgeons. We do collect 4,000 rupees processing fee for MK media provide. And if we provide in corneal media, 1,000 rupees that corneal cost include, that means 5,000 rupees per cornea in corneal media. So that is sufficient actually.
Right, I think there are a couple, no, it's nothing.
A small amount of money. People should not hesitate to pay.
Yeah, there are 2 or 3 things here that I think. One, there is no government mandate on this as to how much it should be or can be.
No, not at all.
So then, on all fairness, there has to be some guidelines which determine what this kind of processing fee should be, and I think that would be fairly regional, because what applies in Delhi doesn't apply in Hyderabad, and certainly doesn't apply in a more remote part. And I think that maybe we can empower the zonal committees to look at these costing mechanisms and try and recommend processing fees for the region, so that there is some similarity between the processing fees being charged by different eye banks who are in the same region. At least that much of uniformity one can possibly achieve. It cannot be done nationally. One number will not suit from north to south. But I think regionally we should be able to, identify what these costs are and at least have that much on processing fee. And I think whatever support we get from the government should be additional to what our costs are. We shouldn't factor in that as the value and then try and say, okay, then we reduce the processing fee. So that can be very dicey at times.
We had a discussion, and the government is more like a subsidy. What the government is providing is, some kind of support, but it's not enough to cover the whole expense. And naturally, the eye bank, as the number of tissues increase, the cost reduces, because all the other things like the rent and the space and all that gets divided among more. So that definitely does make a difference. But I think this is a very good point that the zonal committees can. Yes.
Optical or therapeutic purpose means there is 5,000 rupees for optical purpose, the tissue used for optical purpose or therapeutic purpose. So that also.
So any for therapeutic also we'll charge saving.
Actually, at this point, we are having, if it's transplanted, a cost is levied, because the cost is divided for those which are not transplanted also. There's a lot of cost involved in eyes that are not utilized, and the recovery has to be from the eyes that are utilized. So in the end, there's a distribution. So if you take out the therapeutics from that, then the optical costs go up further. And then to monitor whether this was used for therapeutic or this was used for optical and have a differential cost on that will be very difficult for each eye bank. So I think some sort of equity, even though in the overall scheme of things, 5,000 rupees, even if it's a therapeutic surgery, is not a lot. So I think that much is the cost to the eye bank, and I think we should, at this point, I don't see any other mechanism. I would, at heart, try and see if I can provide therapeutic tissues free, but it doesn't realistically happen.
Any other point which anybody would like to suggest? So, Ganesh would like to give some update about the zonal committees.
I think the one important thing, we informed you, is that the annual CME will be at Pune on 15th and 16th. And we are also in the process of decentralizing the management. Like, so zonal committees will be formed so that with representation from each state in that particular zone, so that the local issues, local problems can be addressed without any delay. And along with Site Life, there is a provision for us to conduct zonal level seminars or training sessions and things like that. So now we will also start an annual zonal training session or iBank get together, something like that, apart from the annual CME. So we are working with all our zonal chairpersons so that we can give a schedule to Site Life, and then we can start the zonal meetings. So these are some of the feedbacks I wanted to share with all of you.
So with that, we come to the end of the session. I'd like to thank all the speakers who had given very good talks, and I will share with Dr. Rishi later on some of the important points which came. And I'd like to thank Dr. Rishi Mohan and Mr. Ganesh for having participated and contributed to the panel discussion, and to the audience for their active participation and interest. Thank you very much. We're grateful to AIOS that they are giving us this forum to have this meeting every year. Thank you.
They have given us this forum for years, and I think it's extremely useful because we're coming from all over the country, and we're able to at least meet here without having to specifically call a CME. But now with the annual CME becoming a bigger and bigger event, we would encourage all iBankers to come for the annual meeting as well. And the annual meeting is always in September, October, whereas the All India meeting is in February. So it's perfect because it's like 6 months apart, and I think we're able to then meet at least twice a year.